Did you know that 6.5 million people in Canada don't have a family doctor or nurse practitioner? That's more than 1 in 5 Canadians. Imagine if our kids couldn't get a teacher at school. We would never accept that. So why is it acceptable for Canadians to struggle to find a family doctor and good primary care? After all, Canada is a wealthy country, and most of us agree that good publicly funded healthcare is important. So why are we in this situation? Consider this. Over the next 5 years, more than 1 in 6 family doctors are nearing retirement age. Canada's medical schools can't keep up, especially as too few young doctors want to practice family medicine. And many who do soon give up. But here's the thing. Doctors can't do it alone. In fact, they were never supposed to. Remember this? Medicare is what defines and represents so much of what we value as Canadians. The problem? We have never really built out the true Medicare system that Canadians need. It is a big reason why finding good primary care has become so difficult. We had a plan. We just didn't stick to it.
We must now move increasingly toward group practice, whether it's community clinics, cooperative clinics, but the need for group practice so as to make possible the practice of preventive medicine.
Tommy Douglas's vision for Medicare was ambitious. He dreamt of an open and interprofessional system accessible to everyone. While doctors and hospitals are covered for medically necessary care by our health cards, we never built a true primary care system. That's a system where everyone has an ongoing relationship with a family doctor or nurse practitioner, ensuring comprehensive, coordinated care. It's all about having a team of professionals working together to meet patient needs. Right now, we don't have a consistent approach to primary care in Canada. We never built the system that Tommy Douglas imagined. And the practice of medicine isn't getting any easier either. Providing quality primary care is more challenging today because people are living longer and their health issues and life circumstances are more complex. Although there are more treatments available, this requires more time and coordination. Then there's the paperwork. Insurance forms, benefit forms, disability forms, referral forms, you name it. Instead of smart information systems, we use, well, too often, fax machines. By one estimate, Canadian doctors spend 18 million hours each year on unnecessary paperwork. Those hours are the equivalent of 55.6 million patient visits, enough to guarantee at least one visit to every single person in Canada. And here's the bigger problem. Without a primary care team, Canadians are left stranded and unable to get the care they need. Chronic conditions like asthma or high blood pressure go undiagnosed and untreated because no one's there to connect the dots, create a treatment plan, or refer you to a specialist. How can we catch cancer early, get the proper vaccines, head off an infection before it becomes worse? Not to mention treating mental health issues like depression and anxiety. So where does everybody go? When we are denied quality primary care, we resort to walk-in clinics and hospitals. But these places aren't designed or equipped to handle ongoing health needs, and waiting times can stretch, and follow-up care doesn't happen. Take emergency rooms in Ontario. 1 in 5 people showing up to the ER are patients without a primary care team and not in need of urgent care. But here's what we know. Having a steady relationship with a primary care team consistently leads to better health and lower mortality rates, less use of the system, and lower costs. In short, with a good primary care, people live better and longer. Other countries get it. They invest more in primary care to get better results and lower their overall healthcare costs. OECD countries spend on average 8.1% of their total health budget on primary care. In contrast, Canada spends only 5.3%. And it's not that other countries do just a bit better. Many countries provide their residents with solid primary care, not for some, but for everyone. Plus, they use better technology, so patients and clinicians can communicate more efficiently. And get this, they don't even rely on walk-in clinics, because everyone has primary care. and clinicians team up to cover you all day, every day. With more doctors on board, working in teams with other health professionals organized to care for everyone, they have basically got primary care nailed down. Here in Canada, we are proud of universal Medicare. But when more than 6.5 million adults in the country don't have a regular family doctor, what exactly are we so proud of? In fall 2022, 10,000 Canadians shared their ideas to define a minimum standard for high-quality primary care.
I'm here because the last time I had primary care, I was pregnant and my daughter turned 31 6 weeks ago.
The result of this national conversation is OurCare, a new standard for primary care in Canada. And the consensus was loud and clear.
It can feel powerless to be in need of primary care that you can't access.
Our current primary health care system is inefficient.
We lack a long-term vision.
Everyone deserves and has interest in a primary care system that works better.
Canadians believe that every one of us deserves access to top-quality primary care, period. And here's their prescription for reaching this goal. Everyone should have a relationship with a primary care team and receive ongoing care in a timely way. The primary care team should be connected to community and social services. Everyone should have access to their health records online. Everyone should receive culturally safe care that meets all their needs. Lastly, everyone should receive care from a system that is accountable to the communities it serves. So what's next? We need to tell governments everywhere in Canada to build the primary care system we were promised. If you want a healthcare system that works for you, your family, and your loved ones, speak up. Primary care needs our care.